The Air Force Small Business Innovation Research Program has funded many critical and commercially successful technologies. This is the story of one of them. Countless lives are saved because of urgent care technologies developed under the Air Force Small Business Innovation Research and Small Business Technology Transfer programs. This is the story of a groundbreaking medical device, the EZ-IO, a technology that administers vital fluids such as medicine and blood to patients in emergency medical situations. One evening, emergency room physician Dr. Larry Miller was working in his garage, but deeply troubled by some tragic news.
One of my paramedics, Nick Davila, was in a car accident south of San Antonio. When the paramedics got there, he was still alive and talking, but he was in severe shock. They placed a tourniquet on his arm and they tried to stick him 20 times and could not get an IV started. They called Air Life in, and before they got him here to University Hospital, he had died.
It was an all too familiar story for emergency medics and first responders. In critical situations like serious accidents, cardiac arrest, dehydration, or drug overdoses, keeping the patient alive means supplying vital fluids such as blood, medicine, or saline solution. Getting those fluids through an IV into the veins of a body in shock can be problematic.
IV access in the critical patient is often exquisitely difficult because their veins oftentimes get very flat. There isn't any pressure inside of them. There's no flow.
This was the problem Dr. Miller was mulling over when an idea occurred to him.
Inside of every bone there was a large non-collapsible vein. And I knew if I could figure out a way to easily get a needle into the bone safely, quickly, people like Nick would not have to die.
So Dr. Miller formed a company, VitaCare, hired an engineering design shop in California, and began testing prototypes.
This is actually an original that we produced. This is actually in the field at one time. Looking at it, you knew there were possible problems with it. You didn't know what you didn't know.
So it was too big, it was too heavy, also it was somewhat fragile when it dropped. Worst problem was we had to change the batteries out after every about 20 insertions. The Air Force came to us and said, you know, we really would like to use this more in our helicopters with our PJs in their backpacks, but it's just too heavy for us. Is there a way you could make a lighter version, a more robust version, and one that was maintenance free?
There's no way we had the funds to go back and redesign our technology and make it better. They provided those funds, and as a result, raised the bar significantly, making this product lighter, faster, more valuable.
Lithium-powered driver. The lithium batteries are sealed, so it's maintenance-free. Has a trigger here. It has an indicator light on it that tells you that it's good to go. Are you ready?
Ready.
Okay. 1, 2, 3.
The redesigned EZ-IO, created with funding from the Air Force SBIR program, changed the practice of emergency medicine.
It improves your ability to manage the condition. It actually can demonstratively make a difference in the outcome of the patient. It changed not only paramedicine, it changed emergency medicine.
There is one EZ-IO device sold every minute somewhere in the world. It has become standard equipment for civilian and military emergency responders, and increasingly, NGOs are finding new uses in their fight to contain life-threatening diseases.
I spent most of my career saving one life at a time, and that's always good. That's why I went into medicine. But with the EZ-IO, I was able to save thousands of lives by supplying this product that other doctors and nurses could use.
The EZ-IO, a revolutionary life-saving medical device, was developed with funding from the Air Force SBIR and STTR programs. Learn more at www.afsbirsttr.com.